Early warning signs of high blood pressure. Blood pressure is the force of blood pushing against blood vessel walls. It is measured in millimeters of mercury. An elevated blood pressure reading means that your blood pressure falls just above the normal level, corresponding to a systolic pressure between 120 and 129 or a diastolic pressure of 80 or less. The new guidelines eliminate the previous category of prehypertension. About 1/4 of Americans have elevated levels, and they have 2 times the risk of heart disease compared with those who have lower blood pressures. Many risk factors contribute to the condition, such as obesity, drinking too much alcohol, smoking, and a family history of related issues. High blood pressure is considered a silent killer, in part because the generic symptoms are indicative of many different diseases and conditions. Lifestyle changes can help many people with prehypertension lower their blood pressure. Here are some key symptoms to watch out for. Brain fog. As people age, slower brain function is normal, but it can also be a sign of high blood pressure. Some people completely lose interest in carrying out daily activities, and this should be a sign to seek medical attention. Brain fog develops when the oxygen supply to the brain diminishes, causing a lack of focus and problems with memory and learning. Sleepiness. The inner organs can grow weak or become impaired due to high blood pressure because the heart is pumping out less blood. Insufficient blood flow results in fatigue and sleepiness. Mental or physical exhaustion without a clear cause is a sign to check blood pressure. Blurred vision. Those with hypertension may experience blurred vision. High blood pressure can damage the vessels supplying blood to the retina, which leads to blurred vision. The optic nerve can also be affected. Blood in urine. Blood in your urine, or hematuria, is a serious high blood pressure symptom. When arteries in the kidneys are stressed due to hypertension, they become weak and prone to rupturing and leaking blood into the urinary tract. You may notice pink, red, or brown urine, sometimes called cola-colored urine. The presence of blood indicates kidney injury and requires prompt medical attention. Severe headaches. Severe headaches are a sign of a rare form of high blood pressure called malignant hypertension. Malignant hypertension is exceedingly high blood pressure that creates abnormally high pressure in the cranium, the part of the skull that surrounds the brain. As the blood pressure increases to dangerous levels, pain builds up in the head, often causing migraines or severe headaches. Malignant hypertension is a medical emergency and should be treated promptly. Nosebleeds. Hypertension can cause nosebleeds which, if they grow progressively worse, can indicate hypertension. This occurs because the increased blood flow harms the tiny blood vessels in the nose. If a person is getting frequent nosebleeds, it is important to check blood pressure. Difficulty breathing. Difficulty breathing could be an indicator of high blood pressure, which causes thickening and stiffening of the heart wall, leading to difficulty breathing. If easy tasks suddenly leave an individual short of breath, this could be a warning sign and should prompt immediate medical care. Flushing. Facial flushing occurs when blood vessels in your face suddenly dilate and become engorged with blood. This reaction appears as reddening or blushing of the cheeks, nose, forehead, and chest. Flushing can happen randomly, but is also triggered by stress, sun exposure, spicy foods, alcohol, and hot beverages. These triggers all raise blood pressure temporarily in those with hypertension. So, if you notice frequent flushing of the face and skin, it could signal an underlying issue of chronically high pressure. Fatigue. Feeling wiped out and extremely fatigued is often chalked up to simply getting older or life stresses. But research shows that high blood pressure and excess fatigue go hand in hand. Why? Your cells need oxygen to produce energy. But when your blood pressure is high, your heart has to put a lot more effort into pushing blood through constricted vessels. This results in full body oxygen deprivation, leaving you feeling constantly tired and weak. Chest pain. Chest pain or discomfort is a characteristic symptom of several severe heart issues. Since high blood pressure strains your cardiovascular system, it can cause chest pain, known as angina. Angina feels similar to pressure, tightness, burning, or aching in the chest. It may occur with physical exertion or even at rest. If you have very high blood pressure and experience sudden, crushing chest pain, sweating, nausea, and radiating pain in your arm or jaw, you could be having a hypertensive crisis or heart attack. Nausea. When blood pressure increases, the heart pumps out less blood, which means less blood is reaching the organs. As a result, extra pressure is placed on the heart. A lack of oxygenated blood to the brain causes digestive uneasiness and nausea. As a single symptom, nausea does not suggest hypertension. However, nausea associated with blurred vision and severe headaches may be a sign of malignant hypertension. Discolored skin. Bluish skin, or mucous membranes, is called cyanosis and is usually due to a lack of oxygen in the blood. Red blood cells provide oxygen to body tissues, usually transporting a full supply. These blood cells are bright red, hence the pink or reddish tone of the skin. Blood that has lost its oxygen is dark bluish red or purple. When their oxygen levels drop, even a small amount, a person may develop cyanosis. This symptom is associated with pulmonary hypertension, high blood pressure in the arteries of the lungs. Dizziness. People with hypertension may experience dizziness due to a lack of oxygen reaching the brain. While dizziness can be a side effect of some blood pressure medications, high blood pressure itself does not usually cause dizziness. Sudden dizziness associated with loss of balance or coordination and trouble walking can be warning signs of a stroke, and high blood pressure is a leading risk factor. Swollen feet. Swollen feet can be a sign of heart disease, poor circulation, or kidney, lung, or liver disease. Medication used for high blood pressure, particularly calcium channel blockers, can cause swollen feet. Causes of high blood pressure. Factors that increase your blood pressure can cause elevated levels. Medications such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs may cause a temporary rise in blood pressure. The buildup of fatty deposits in the arteries can also lead to prehypertension. Other conditions that may lead to prehypertension include the following: obstructive sleep apnea, kidney disease, adrenal disease, thyroid disease. Treatment of high blood pressure. If elevated blood pressure levels are accompanied by diabetes, kidney disease, or cardiovascular disease, your doctor may suggest blood pressure medication as well as lifestyle changes. If elevated levels are your only condition, lifestyle changes can help prevent blood pressure from rising. The following are lifestyle changes that may help lower blood pressure: losing weight if overweight or obese, eating a healthy, low-salt diet, exercise regularly, limit alcohol consumption, quit smoking. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.